this next video. This could really be a long, wordy video, and I don't want it to be. I want it to be kind of a layman's video for MS drug therapies, because if you have MS, I'm certainly not I'm not a doctor. I'm not the expert. A lot of what I'm saying is what I've read, what I've been told by my doctors, what videos I've watched, research, podcasts. I mean, I'm just like hungry for all this information. So it's kind of like a collection. So I'm just going to kind of dumb it down. So if you do have MS and you're thinking, oh, she totally skipped over that topic of medications, I'm kind of keeping it simple for the friends and family or that first person who's trying to figure out what the heck's going on. And cats, oh, everything, it's always something in these videos. Okay, so first, MS so far, there's no cure. There's no curative treatment plan. There's treatments for symptoms like depression is common in MS, fatigue. There's medications they can give you to help with your bladder or whatever your symptoms are. That's not going to treat the disease progress, right? There's treatments for relapses. That most commonly is very high dose steroids. And there's also ACTH, plasmapheresis. I'm reading my notes. But the medications I'm going to talk about, and the medications when people talk about their MS medications are typically referring to their DMDs or DMTs. Those are interchangeable. Those stand for disease-modifying drugs, disease-modifying therapy. So they, in general, do not claim to make you feel better. They are just modifying the course of the disease. The goal is to hopefully kind of slow it down or stop it so that you don't get worse. But it's not necessarily, if your baseline is kind of already changed, going to make it better. However, some patients, including myself, do sort of experience a little bit of relief when they're on disease-modifying drugs. In really what should go hand in hand in this video is discussion about lifestyle change. Mainly food and diet and what we're eating. There's two big diets that are really popular in the MS community. Dr. Swank's, which is, I think, the MS protocol, which is basically a low saturated fat, no animal fat kind of plan. He was a brilliant neurologist, a lot of research. And then there's the Walls food protocol, who is a doctor who had MS herself and sort of cured, improved her MS with diet. I'm not going to talk about that right now because I'm still trying to figure that out myself, and I really feel like they're basically opposites. Like hers, I don't want to misquote because I haven't read hers enough, but it's similar. I'm going to say it's similar to paleo, but they're kind of opposite, and I feel like people have had great success on both and some failures on both. So it might just come down to what your body responds to as far as reducing inflammation. So I'm just talking about the disease-modifying drugs. If you have MS and you're frustrated with that, leave me a comment. I certainly went through in my whole denial phase, questioning. I was scared to take drugs, and I was scared not to take the drugs. I was scared of taking them because they're pretty brutal, some of them, most of them. Some of them are fairly safe. And I was scared not to do anything because there's no going back. If I I'm gonna do this food plan and I'm gonna treat my MS naturally, which every person on the corner of the street wants to tell me to do. Like pretty much, I get a lot of videos and articles and things pushed my way about, oh, did you know you could cure MS with wheatgrass? And thank you if you're the ones that sent me those. I'm not saying I don't believe in that, because I am doing those things. I am doing natural things. I am taking turmeric every day, and I'm doing things naturally. But I, after my own research, everyone has to do their own research, did decide to go with the DMD. you know, I really didn't want to play that sort of roulette game. I do know people who with MS who did that and regretted it because, you know, specifically there's one woman I follow who has a blog and she's now wheelchair bound and she's wished she could go back and start her therapy sooner. And I don't ever want to be in that position. Now, naturally, I wanted to choose the best medication for me for efficacy and safety. And that's kind of what I'm going to talk about. I'm sorry. I feel like I'm so all over the place all the time. I really try to stay focused, but I'll just blame it on the lesions in my brain. Is that a cop-out? Part of it's probably just my personality. Okay, so I kind of have to start back with, I think the real problem with, this is kind of a nationwide, I don't know if it's it could be internationally, but they talk about it as being a nationwide phenomenon. There's a real shortage of people going into neurology, doctors, residents going into neurology, and specifically treating patients. Because the opposite and so confusing, frustrating part is the research out of all the neuro diseases for MS is just exploding, and there's just all these treatments and all these options and all this new research. I'm getting a package delivered. So like the physicians are, I'm so easily distracted. I'm so sorry. The physicians are going into research instead of like treatment and care. And with that comes, I think, the biggest problem with choosing your DMD. This is kind of a very common scenario. For me, I kind of knew MS was what was coming my way. I could see it down the pipeline, so I wasn't like shocked at this doctor's appointment when she told me, you know, you have relapsing remitting multiple sclerosis. I wasn't like, what? Tell me more about this. I was kind of like, okay, I know. Let's move on to what are we going to do about it? But I still, even though I was like ready for it, and I knew it was coming, I still kind of like went into this like, glassed over. And she's like, okay, so here are your medication options. And she went boom, 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 laid them out, kind of guided me a little bit, and said, which one do you want to take? You can take some time to think about it, but let me know which one you want to take. And every time I asked a small question, like she talks about me now at that appointment as having a lot of anxiety over medications. And I did, because I'll talk about PML in a minute, but I was really afraid of this thing called PML, which can kill you. And so I was like, I don't want anything that can cause PML. I was kind of like chunking out drugs. And so she would just say, that's reasonable. I think that's reasonable. That's reasonable. When I myself kind of narrowed it down to 2 medications. And she just said, that's reasonable. And I just left that appointment feeling like, what? You know, not that I had MS, I kind of knew that, but you know, you get sick and you go to the doctors and they say, this is what I want you to take. This is what's going to help you. This is what I think is best for you. And I think the problem with MS and these medications is they put a lot on our plates of go home, do your research, talk to people, and let me know when you decide. And then so you get home, and if you're indecisive like me, you're reading, and you're kind of going in circles, and you're making pros and cons lists, and before you know it, you're just not making a decision, and you're putting it off. And that's what I did. So I think that's kind of, from what I've found with talking to people, it's kind of common, unfortunately. There are some great MS clinics that do a really good job at sort of educating patients, giving them an appointment to educate them about MS, and sort of the next appointments to talk about therapy options. And they really sort of don't lay all the options out for you, just give you like the physician's best 2 options. But I had them all laid out to me. And sometimes you don't have a choice. Sometimes your insurance says you have to start with a platform drug, which I'll talk about now. So there's 3 categories for DMDs. They're what they commonly refer to the platform drugs, the ones that have been around the longest. Those are the injectables. They are Avonex, Betaseron, Copaxone, Extavia, Vladimir acetate injections, Gletopa, it's another version of that, and I think those are generics. Plegridy, Rebif, and Zimbrita. Some of those are like different, I'm not a doctor, generic versions of each other. I briefly considered some of these, and so the injectables, some are once a week, some are 3 times a week, some are daily. A very common starter drug for RRMS, relapsing remitting MS patients, is Copaxone, and a lot of people choose that one for its safety. These are sweeping numbers. I mean, again, if you have MS and you're thinking, well, she really generalized there, I am. The general statistic on the injectables is they're about 30% effective at reducing relapses and lesions. So 30%, I really felt like wasn't a very good number. To me, it really wasn't a very good number, although my husband was like, that's not so bad. That's a third less. And I just thought, I don't know. It doesn't sound, for some of the side effects, the Copaxone has very little side effects. I think the biggest one, I don't know why it bothered me so much, is that some people have site injection issues and end up with permanent sort of dimples, like a golf ball, like wherever they have to inject. Some people don't have any issues. People have been on Copaxone forever and love it and have had great results. But I really just didn't want to do it. I don't travel a lot. Sometimes it's people travel a lot. They don't want to bring needles. I just thought if I could avoid, and I don't have a needle phobia. I do have claustrophobia. I don't have a needle phobia, but if I could avoid that every day, I've got kids around, having needles around, that would be great. But that was one we narrowed it down to as maybe Copaxone. And then there's the oral medications, and I have to just say, all of these medications are fairly new. You talk about these injectables as being the platform drugs for safety and efficacy. They came out, 1991, 94? 1991, I believe, was the first. And think about medical stuff. It's really not that long ago that we had our first DMD. So, but the oral medications are new. Like if you have MS, they've been around a while. It's like, 5 years, that's a long time. But that 5-6 years is not long in the medical world for like long-term, what is this going to cause? What kind of damage is this going to cause my body long-term? And so the oral medications are Aubagio, Gilenya, and Tecfidera. Now I'll talk about the PML. So, let me just tell you. So then the third category, the first category, platform drugs, injectables, oral medications. Second. Third, the infusion therapies. The infused medications are Limtrada, Ocrevus, and Tysabri, and the Novantrone. I think the Novantrone, I don't know if that's still used. I'm so sorry. So PML, that's what I'm talking about, PML. They didn't know at the time when they first started these, I think it was Tysabri was the first. There's just unknown risk, right? They think through trials it's fairly safe, but there's unknowns. And with that came PML, which is progressive multifocal leukoencephalopathy, PML. And it essentially, what they found, test positive for the JC virus, which is something they can screen for. It's a virus, very common. It's not dangerous, usually, to the mass public, something a lot of people have been exposed to. But if you're on these medications that are suppressing your immune system to a point that they are, and you're JC positive, they can give you an index for that, like how long you've been on the drug, your positive antibody, I don't know, all these scientific words. They can tell you like your risk level of getting PML. And after a few years on these drugs, they usually take you off of it if you are JC positive. So if you're JC positive and you're on some of these drugs, it doesn't mean you can't take them, but it's a risk you're taking. You could get PML, and PML is horrible and ugly and often fatal. I don't think it always is, but it's, if not, you're going to have severe neurological damage. PML is worse than MS. So it happens. It's actually, it happens, but if with proper sort of screening and monitoring, these drugs are very safe. I know that sounds, it's just these risk benefits you have to weigh. So I didn't know when I was at my appointment if I was JC positive or negative, but I was like, I don't want anything that's going to cause PML. No, don't want it, don't want to die. And she kind of was like, okay, that's reasonable. It turns out I'm JC negative, which is great, but at any point I could become JC positive. At any point I could be exposed to this virus. So it's something you have to keep monitoring. But I was like, nope, I'm crossing everything out that has had PML. And there have been since then a few, and I mean, I think a few, with Gilenya, an oral medication, and I want to say Tecfidera too. So it's something they still monitor when you're on those two oral medications. But because Aubagio didn't have the risk of PML so far, that was my other option. I thought Copaxone or Aubagio. I liked that it was an oral medication. But with Aubagio, a lot of people think I'm cuckoo for starting on it, choosing it as my first DMD because it has some big risks as well. It can be very damaging on your liver. It can cause liver failure, and it has caused liver failure, and it, I believe, has caused a death from liver failure. But that, I think what I read, it was a really poorly monitored patient. You have to have your liver enzymes checked. It takes a compliant patient too. You have to be willing to go every month to get your lab work done. If your doctor can say, I need to monitor you, and if you don't go in, you haven't done your part either. And compliance is another part with Copaxone. I thought, I hate taking medicine. At the time, I'm better now, hate taking my vitamins. I hate taking anything. So I thought, am I really going to be diligent about taking my daily shot? Or is it more likely I would take my little pill? And it was definitely more likely that I would take my little pill. So I went with that. Aubagio is not for everyone. Aubagio is category X with pregnancy. It's like the only drug that's like, no. Some people actually take Copaxone when they're pregnant. Copaxone by far, I think, is the most safe as far as side effects. And I'm done having babies. I'm not going to have any more babies, so that wasn't a problem for me. I have had a really interesting sort of discussion with a nurse practitioner who works in neurology with MS patients specifically, and she was at an Aubagio sort of event. These drugs are so expensive. They hold luncheons for you, and they feed you. And anyway, they answer all your questions, and they bring specialists in. And she said she kind of looks at Aubagio differently than a lot of providers because there's a protocol to wash it from your body. Aubagio has a very long half-life. If I just stopped taking it today, it could still be in my system 2 years from now. So that's a long time. So they have a washout protocol to get it out of your system. So if you find out you're pregnant, she said, in a way, it's better because I know I can get it out of your system versus the other drugs. There's nothing I can do. It's in your system. There's not real hard data what it does or how long it's in your body, but we can get Aubagio out of your system. So she does give it to women of childbearing age who are still thinking maybe someday I'll have a baby. So there is something they can do. Like if you needed to get it out of your system, you can. So that's good to know. Kind of the flip side, the pro to that is if you're traveling and you forget your medication and you can't take it for 2 days, you're fine. It's totally still in your system. You're not going to have trouble like getting your levels back up. If you miss a dose, which I don't. I've missed a few, but not. I'm pretty good about it, shockingly. I'm pretty good about getting that in. Okay, so then this is the big one for Aubagio that a lot of people, some people stopped taking it because of this, and it was probably one of the main reasons why it took me about a month to decide to just do it is it causes hair loss. Dun, dun, dun. And at the time when you're told that, you're thinking, it's bad enough I might be in a wheelchair or I might need a cane. Now I have to have no hair. But the truth is, it isn't like these huge chunks come out and you have like these bald spots. It really is like a shedding, kind of like post-pregnancy or when you stop nursing your baby, your hair kind of starts shedding. The only difference is you didn't have a pregnancy beforehand to kind of build up all that pretty thick hair. And I already have really thin hair, and I was like, oh, I have really thin hair and it's gonna all fall out. And I just kind of had to really kind of get at peace with myself that I was being vain. And the truth is, Aubagio has some really great statistical numbers behind it. It's 80% effective at reducing new lesions on MRI. 80%. Like, so I had an 80% chance of not getting a new lesion. That sounded like good numbers to me. And it's actually the only one that can claim a reduction in disability. I might be saying that wrong. Future disability, which also sounded good to me. And it has like a 40%, I want to say. Again, I'm really kind of generalizing, 40% reduction in relapses. And I think Tecfidera and Gilenya, the other orals, are similar. Gilenya, I wasn't really worried about PML with Gilenya and Tecfidera. I think it's pretty rare, but they have their own sort of side effects. Gilenya kind of scared me. You have to have your heart monitored the first time you take it because like your heart might stop. So the company, the drug company will actually, or insurance will pay for a doctor to come to your house to sit with you for like 6 hours when you take your first dose. You only have to do your first dose, but I'm like, I don't know. Or you go to the hospital. I think I'd rather be in the hospital when I took that. But a lot of people love Gilenya. A lot of people love Tecfidera. Tecfidera has a lot of flushing symptoms with it when they take their medication. Tecfidera has a lot of GI side effects. And so does Aubagio. That's another one. Aubagio has some GI. I didn't have any GI issues until recently. I don't know, it was like 6 months in, I started kind of having some slight GI, but totally manageable and not something that hinders me from coming off of it. But some people really do struggle with that. Another side effect with the platform drugs, the injectables, and a lot of them cause flu-like symptoms. And so people will have to take, and I'm not sure which one, Avonex, Rebif, one of those. Once a week, they'll have to kind of schedule their week around this. If they work full time, they'll be like, okay, I take my shot Friday at 5 o'clock so I can feel like I have the flu all weekend and feel good enough to work all week. And they do that every week. And I just don't have time for that. I don't have time to feel like I have the flu every week. And so I really just didn't want that. Now, again, these are choices we all have to make for ourselves. And I think a big part of the reason why the doctors give us so much power in what drug we want to start with is because the side effects are so shitty. Like, they're so crappy that they're like, you decide which crappy side effect you want more. It sounds horrible, but it's true. I mean, and a lot of times I think you have to just really have the right questions for your doctors because some people are really worried about safety. Like they just really, we're all worried about safety, but that's like their main thing. Efficacy is like, eh. And I was willing to take a little risk with safety and trade for efficacy because I'm really hoping to prevent disability. Looking at my notes. This doesn't really have to do with the medications. I just thought this was interesting. We talked about it being possibly genetic or familial. They now know that there's at least 100 genes, 100 genes that make a patient vulnerable to MS, right? And they know that if this person has this vulnerability and these genes, and they're exposed to environmental trigger like chronic low vitamin D exposure. Hello, I've lived up north my whole life. Or even the Epstein-Barr Virus exposure. That's another big topic that goes around the MS world is the Epstein-Barr virus, which causes mono. does that sort of trigger MS? That kind of leads to that autoimmunity. And what's interesting is, and I found this in a YouTube talk. There's like a sweeping, if you tested everybody with MS, there's a sweeping, they all have antibodies to the Epstein-Barr virus, meaning they've been exposed to it. And so they're like, oh, that must be it. That must be why. That's the trigger. So if we, keep people away from that, maybe they won't have that trigger if they're more susceptible. But if you test the entire adult population, it's like 80% has been exposed to the Epstein-Barr virus. So I don't know. Did I talk enough about the drugs? I don't know. I mean, what happens often with people is they'll be on a drug, it's working for a while, and then it just kind of stops working, so I have to switch therapies. Well, I didn't really talk about the infusions. The infusions I think get the most excited about. I think usually they're usually I don't want to say last resort, because some people do start on them. But I think more serious cases are more, they really kind of wipe out your immune system. But the science behind some of them really, I think, makes sense. For example, Limtrada. So Limtrada is like a low-level chemo, we'll call it. It's chemotherapy. And you take it for like 5 days. Year 1, it sort of kills off your immune system. You get like a little bit of immune system left. And, with MS, your immune system is attacking your central nervous system. So if your immune system's gone, you shouldn't have a relapse. Like, you shouldn't have new lesions. You shouldn't have any disease progression. So that's kind of exciting and brilliant to me. Like, oh yeah, just kill it off. Then you think, well, obviously now I have no immune system. I'm going to get sick. I'm prone to infection. Of course, they watch all that. Anyway, so then there's year 2. You take another treatment year 2. And then after that, they let your immune system build back up. And hopefully it's building back up in a normal way without these overactive immune cells, which is kind of genius to me. So if I ever have to move to these infusion therapies, I'm not too afraid, although there's risk of PML and all. They're more risky. There's a lot more side effects. But I think that there's a lot of hope for them. Ocrevus is just recently, this was just like August, I want to say, of 2017, is the first drug, and it's an infusion, approved for primary progressive MS. I've said this in my other videos, relapsing remitting is like the most common first diagnosis, but then there's primary progressive, and there, up until this year, was no treatment for them. Nothing that the insurance will pay for, nothing, until Ocrevus came around. It's been approved. So that's really good news. Oh, I guess I'll talk about how is Aubagio going for me? So I handled it well. I'm handling it well as far as side effects. Yes, I've lost some hair. It's slowing down. I had to cut off about 7 inches because it was really thin on the ends. But that's fine. And I had an MRI in December. I hear my daughters are trying to come out and sneak. And remember, I was talking so much about how claustrophobic I was. Well, our lovely, lovely, lovely nurse, who was so wonderful for me for conscious sedation, retired. And where I live, there's nobody else apparently. So I had to go under general anesthesia, which sounds so excessive, and I really hate it. Like, I'm really trying to think of other options for me. Like, should I try hypnosis to get over this fear if I'm going to be needing all these MRIs? Has anybody had good luck with that? I'm thinking about it. Anyway, I had to be intubated, had to be totally knocked out to get it done. And it went well. Obviously, I don't remember a thing. It went well. So I just like float off every now and then to like La La Land. And my results were pretty good. I mean, they weren't perfect, but they were pretty good. Again, if I was a fancy YouTuber, I could insert my MRI images. Maybe one day I'll do that for you guys. I had no new lesions. Yay, that's great. That's what I was hoping for. But my cervical spine lesion, my one that everyone's most concerned about, my biggest lesion, was bigger. And so it, it was before just in my spine. Now it's pretty much taking up the whole width of my spinal cord. Yay. And so the ultimate goal on MRI is, I think it's the NEDA, no evidence of disease activity. Like that's the ultimate goal. Like they want no evidence, right? No atrophy, no lesions, no growth, nothing. And so I did have sort of a mark. I did have some growth. But the thing is, my previous MRI was done in, April or May, April. And I didn't start Aubagio until July. So do we know, was that lesion still active? And, because I was still in that relapse, was it still growing until July? Then I started Aubagio and everything calmed down, or did it happen after Aubagio? So I have another MRI scheduled for the summer. That'll give us a whole year on the medication to see if it's really doing its job. And the truth is, you have to give these drugs time. You have to give them time to do their job. It's not like a week later you're suddenly better. I will say, and if anybody from Aubagio, which I highly doubt, ever watches this, they might say, oh, you can't claim that. They can't claim it, but I can claim it. I really do believe it's helped my baseline. It could have been coincidence with timing as like coming out of that relapse is when I started taking the medication, but I felt better. I felt like my baseline improved. I've been able, my Lemaire sign, Lemite, remember that? Tomato. When I put my chin to my chest, it doesn't happen. I don't want to say ever. Every now and then it does, but it's nearly gone, which is great because that was really annoying. And I just felt like it helped my baseline a bit. But anyway, I think that's enough blabbing on. Oh, one last thing, and this is so important, and this is so sort of devastating for some people with MS, is these drugs are expensive. And when I say expensive, I mean like triple a mortgage. My medication is $6,000 every single month. It's like $78,000 a year for just the medication. And then you have MRI costs and all these costs. MS is extremely expensive. I don't even want to know what the infusions cost. I'm sure they're more. Copaxone, I don't want to misquote, but they're $5,000 a month. And the drug companies do a good job at, well, someone will comment, they do a good job at overpricing them. The whole industry, I mean, with the insurance company and the drug companies, is just kind of a mess. But these are really specialized drugs, and you think about the amount of people on these drugs versus the amount of people on like Lipitor or like a blood pressure medication is so drastic that in order to keep making this drug and the years that went into trial and everything, they're very specialized and they're really expensive. Really expensive. But what I was going to say was the drug companies do a good job at like copay assistance, helping patients get it when they can't get it, but there's still people who pay hundreds, thousands a month. I am so fortunate, and it really, knock on wood, is like for now, my copay has been covered. It was like $500 a month, down from $6,000, and I got the copay assistance to make it $0. So that's great, but I don't know. I kind of felt like a big dollar sign for a while there because the drug companies, they really cater to you. You get like your personal nurse that calls you. You can't just go down to Walgreens or Walmart or CVS and pick up your medication. It has to be shipped to you monthly. I have to call every month to get my prescription filled, and it comes to my doorstep because they don't have it down there. That's not how it works. So they cater to you. They really, and that's nice in some way. And at the same time, it kind of creeps me out. I'm like, they're really kind of like going out of their way to do things for me. And it just makes me think, how much are they making off of me? Anyway, the drugs working. So, and all my people who are going natural with MS are probably cringing that I even have that feeling, but I really do feel like it's helping me. So cross your fingers that it continues and that my next MRI has a better NITA score of no evidence of disease activity. And thank you again for watching. This video was way longer than I wanted it to be. I apologize to all my fellow MS warriors who thought I generalized their medication or talked bad about their medication. I mean, people do well on each of them. So have a lovely, lovely day.